Hey everyone. um, we went over week one of HIV and AIDS for the sixth grade curriculum last week. And this week we're going to talk a little bit more about what HIV is, how it's transmitted, how it's not transmitted, and ways to prevent getting it. A couple of things to review from last week. Um, we talked about how our body is like a castle. We have like little soldiers in our body that help us fight off germs and infections. Um, and we went over how germs enter the body, breathing in germs when someone sneezes or coughs, through cuts or skins, through touching, um, and blood and bodily fluids, and ways to stay healthy: washing your hands, eating nutritious food, exercising, getting plenty of sleep, and going to the doctor, getting your checks up, and getting your vaccines. So, for this week, a little bit more in depth, more vocabulary, and then I'm going to have a brain pop video for you at the end. Okay? Let's see if I can. There we go. All right, so HIV is human immunodeficiency virus. It slowly attacks the body immune system, making infected people potentially vulnerable to other infections and diseases. That's the first step. You get HIV, you have it for an extended period of time. Once your white blood cells go to, I forget what the number is, a certain number, your body then has AIDS. Okay, this is the most advanced phase of infection with HIV, in which the immune system is weakened. The person becomes more susceptible to a variety of infections called opportunistic infections and other conditions such as cancer. A diagnosis of AIDS is made based on a clinical criteria and the result of a blood test. Specifically, AIDS is diagnosed when a person's white blood cell count is below a certain number. We went over antibodies, antigens last week, and another word is abstinence, when you refrain from an activity. So, HIV. Before we get into HIV, we're going to talk about the flu. A flu and influenza is a virus that is airborne, so you can get it throughout the air. A person who is infected has symptoms of a flu, which is headache, body aches, fever, fatigue. The immune system creates antibodies, which eventually destroys the virus. The person becomes very ill, and the immune system stays strong. Antibodies create the immunity to that particular flu virus. Okay, so when you are sick, if you get the flu, you get a certain strand of the flu. Once you have it, your body creates immunity to that flu and you should not get it again. Now, this is the opposite of when you have HIV. The infected person with HIV may have flu-like symptoms after being infected. These symptoms go away. The person may not show any further visible symptoms for as long as 10 years or more. But during the time, the virus is damaging the immune system, and the person can still transmit the virus to others. So this person may never know that they have the virus, and they could be transmitting it to other people. And we'll tell you a little bit later on how you can transmit it to other people. The immune system creates antibodies, but unlike the flu virus, HIV is not destroyed. So when we have the flu, our body creates antibodies. Our immune system fights off the infection, and we become immune to this. This does not happen in HIV. So HIV is not destroyed. Instead, HIV attacks the T cells, which is a type of white blood cells that are essential for fighting off infections. HIV takes over the T cells and begins to multiply. The immune system breaks down. Certain medications can help slow down the process by preventing HIV from attacking the immune system and protecting against opportunistic infections. Diseases that people with an active immune system are unlikely to get. So like cancer, anything to make them more vulnerable to diseases. Some people with HIV are able to fight off opportunistic infections longer, while others become less and less able to fight off infections and eventually develop AIDS, or acquired immunodeficiency syndrome. which is a group of related diseases that people with advanced HIV infection sometimes gets through these diseases, which, I'm sorry, I was moving my screen around. Sometimes these diseases are fatal. Sometimes the person who has AIDS recovers, even though his or her immune system is still quite weak. Another difference between flu-like viruses and HIV is that the flu vaccine helps people from getting the flu, but there is no vaccine to prevent HIV. Okay, so how it could be transmitted. I'm going to move you guys back down here. By sharing unclean needles, syringes, other injected drug use equipment, and sharp objects that can transfer blood from one person to another. Some people need to inject medicines such as insulin for diabetes. They always need to use sterile needles and never share them. So this also goes for when you're at the doctor, if you're getting tattoos, if you're getting piercings. You never want to use an old needle. Okay? There's a law where if you go to a doctor's office, you go and get a tattoo, you get your ears pierced, anything. As you're at the place, you should be sitting on the table, you should be sitting in the chair, whatever you're getting done, and the person should come over with a clear bag and open it up right in front of you. And in that clear bag are the utensils they're going to use for either getting your blood drawn, getting a vaccination, if you're getting your ears pierced, a tattoo, anything. So you have to make sure that you are using clean instruments if you're getting any of those things done. Another way is from an infected pregnant woman to a child she is carrying. Through an infected mother's breastfeeding a baby. So you could get it through birth, or you can get it through breastfeeding. Now, if you have a mother that is HIV positive, there are other ways to give birth. But if you give birth in a clean way, you should not be breastfeeding a baby. By transfusion of HIV-infected blood. Okay, this does not happen anymore. Since 1985, the blood supply in the U.S. has been carefully tested for HIV. This mode of transmission is highly unlikely now, but not impossible. Most likely, you were never going to get HIV from a blood transfusion. By sexual intercourse with an infected person or a partner, not having sex is abstaining, and it is most effective way to avoid the sexual transmitted of HIV and other sexual transmitted infections, such as STIs, as well as to protect against unintended pregnancy. This camera, sorry, is cutting off half the words. Abstinence is the safest choice young people can make to prevent HIV infection. So abstaining from any kind of sexual activity is the best way to prevent HIV. Okay. Next, how it cannot be transmitted. It cannot be transmitted through sneezing, coughing, kissing, sharing towels or utensils, using public bathrooms, so using the same toilet bowl seats, using public telephones, which no one really uses public telephones anymore. I guess if you go to like the main office to make a phone call, but usually you have your own cell phone. Being in the same room as someone with HIV, eating with someone who has HIV, holding hands, or having other form of casual contact with someone who has HIV. So hugging, holding hands, I don't know. Mosquito bites, you cannot get HIV. And activities like kissing, hugging, touching that entails no contact with semen, vaginal fluids, or blood, are not ways that HIV can be transmitted. How to prevent HIV. Abstaining from alcohol and other drugs, which impairs decision making and may lead to risk behaviors that can transmit HIV. Obtaining from sharing sharp objects such as needles, razors, pins, scissors that might be used by someone's skin, on someone's skin, and led to exchange of blood if someone else uses them too. Back in the day, they used to call something blood brothers and blood sisters, where if you had a best friend, I don't know, you prick your finger, you cut your finger, and they would cut their finger, prick their finger, and then you would touch fingers, and then you would become blood brothers or blood sisters. This may put them at a risk of HIV or other infection because it's blood touching blood. So if one person has HIV and they don't know it, and they touch someone else's blood, open cut, anything, they can transmit it. Abstaining from sexual intercourse is the healthiest, most appropriate choice for young people. If anyone pressures them to have sexual intercourse, they should say no and tell a parent, guardian, teacher, counselor, or other trusted adults. Young people who do have sexual intercourse should know that correct and consistent use of condoms will reduce but not eliminate the risk of infection with HIV and other sexual transmitted infections. Stay informed and make sure you and your friends know the facts about HIV and infection and practice good decision making. Ways to promote good and physical health and emotional health. Avoid using alcohol, tobacco, and other drugs. Practicing personal safety, practicing responsible decision making and obtaining from sexual intercourse. Adopting infection control practices, practicing good nutrition, getting enough sleep, express feelings. My watch is talking to me. Fostering supportive relationships with family and friends and others whom they are close to. Choosing friends who also cultivate in good, healthy habits. Okay. Next week, we're going to go over peer pressure and how HIV/AIDS changes our society. Okay. And what needs to be done in the future.
Okay, well, this seems like a good time for a snack break. Yeah, medical research is tough work. Best left to professionals. Dear Tim and Moby, what is AIDS? It sounds pretty scary. From RIS 106. AIDS is short for Acquired Immune Deficiency Syndrome. It's a disease that damages the body's immune system. Well, your immune system is your body's way of fighting off sickness and infection. T cells are an integral part of the immune system. They stand guard over your body, waiting to organize and drive off invading pathogens, viruses, and other harmful microorganisms. But a virus called HIV, or human immunodeficiency virus, can cause particular trouble for your immune system. Instead of just trying to get into your body, it attacks the T cells directly. When enough T cells are destroyed, the immune system is weakened. Illnesses that your body can ordinarily fight off, like a cold or the flu, can get in and cause serious health problems. As you may have guessed, HIV is the virus that causes AIDS. A person is said to have AIDS when the immune system reaches a really low number of T cells, and it gets to that point where the body can't fight off infections. Well, you don't catch HIV like you'd catch a cold. You can't get it from hugging, holding hands, sharing a sandwich, or sitting next to someone who has the virus. And it's not spread by mosquitoes or swimming pools. HIV is only spread when the bodily fluids from one person come into contact with the inside of another person's body. Most people contract HIV through unprotected sex and intravenous drug use. The disease can also pass from a mother to her baby, usually during birth. Well, there's no cure yet, but progress has been made with treatment. With the right care, people with HIV may never actually develop AIDS. But it's still important for adults to get tested routinely. The virus can stay in the body for years before it actually makes you sick. Those being treated for HIV need to get routine tests too. Sometimes one treatment will work for a while, and then the virus will mutate or change form so the medicines don't recognize it. Doctors and scientists are working hard on a vaccine to prevent AIDS, just like the ones we get to prevent measles or mumps. but there's still a lot of work to be done before a vaccine or a cure can be found. I'm not sure they'll let you back in the lab. I mean, you've already broken like 52 test tubes today. Hey, maybe you're just too clumsy for lab work.
So I hope you enjoyed that video. Again, a lot of good information in there based on HIV. It was a nice little review on what we just went over. Next week, we have a couple other little topics that we have to go through, and then we'll be done. We're done with remote learning. We're done with school for the summer. It'll be a great thing. If you have any questions on the questions that are posted, please ask. Have a good week.